In the middle of a chaotic drama zone, a medic's biggest enemy is usually the one they can't see: internal bleeding. So today, we're going to dig into a breakthrough in AI that could give them a kind of superpower: the ability to see that hidden threat instantly. Think about it. Every single second is critical. One moment of hesitation, one wrong call, and a life could be lost. That's the brutal reality of trauma care, and it's this high-stakes environment that researchers are now hoping to totally transform with artificial intelligence. So, how do medics even try to find this invisible threat right now? Well, the answer is a really powerful piece of technology. And this is a big but, it comes with a critical, potentially life-threatening flaw. That tool is called point-of-care ultrasound, or POCUS for short. You can pretty much think of it as a pocket-sized window into the human body. It's portable, it's non-invasive, and it can be used right there on the scene of an accident to look for free fluid, which is that classic telltale sign of internal bleeding. And right there, that's the core challenge. The potential of POCUS is absolutely enormous for guiding treatment. But to master it, to get clear images and then actually interpret them under incredible pressure, that takes years of training. In the chaos of an emergency, that kind of expertise is a luxury most people just don't have. Now, this seems like a perfect job for AI, right? So researchers from the U.S. Army Institute of Surgical Research, they set out to build an AI copilot. Their first attempt was logical, it was straightforward, and, well, it turned out to be a really sobering lesson in just how complex real-world AI can be. Their approach was pretty standard. They took a deep learning model and fed it over 60,000 individual ultrasound images from experiments on swine where they had simulated injuries. The idea was simple enough. Just show the AI enough pictures of what bleeding looks like, and it should learn how to spot it. But when they actually tested it in a real-time situation, the results were, frankly, alarming. For the pelvic region, which is a critical area to check, the AI's accuracy was just 59%. I mean, that is barely better than a coin flip, and that's a terrifying gamble when a life is on the line. For another key area, the right upper quadrant near the liver and kidney, it did a little better, hitting 70% accuracy. But still, a 30% chance of being wrong is just way too high for a critical diagnostic tool. The first attempt, it was pretty clear, had failed. You know, the researchers themselves put it best: the models struggled to generalize. What that means is they were great at recognizing static images they'd seen before, but in a live, unpredictable situation, they were just lost. They were completely missing the bigger picture. Okay, so this is where the story gets really, really interesting. Instead of just trying to tweak the old method, the researchers went back to the drawing board and completely rethought their approach. They realized they needed to teach the AI to see not just a static picture, but the entire movie. They called this new method frame pulling. So instead of analyzing one frame at a time, the AI now captures a short video clip. Then it pulls a sequence of those frames together, analyzing them all at once to get the full context. It's so much closer to how a human expert actually assesses the situation, looking for those subtle movements and changes over time. To make this happen, they had to upgrade their tools. They moved to a much more powerful AI architecture called EfficientNet B2, and they set the window to 150 frames. What that means is that for every single diagnosis, the AI was now looking at about a 5-second video clip, not just a single frozen snapshot. So, the big question: did this new way of seeing things actually work? Well, the results weren't just an improvement, they were a complete revolution. I mean, this chart tells the whole story. On the left, you've got that inconsistent, totally unreliable performance of the old single-frame method. And then on the right, you see the confident, stable, and highly accurate diagnosis from the new frame-pulling method. It's really the difference between a total gamble and a reliable partner. And here are the hard numbers. For that pelvic scan site, the real-time accuracy skyrocketed from that dismal 59% all the way up to 94%. And for the right upper quadrant, it jumped from 70% to an incredible 95%. This wasn't just a small step, it was a giant leap in capability. So what does a 95% accurate AI really mean for the medic on the ground, and for the patient whose life is hanging in the balance? It means smarter triage, which directly leads to more lives saved. An AI like this doesn't replace the medic, it empowers them. It shoulders that huge cognitive burden of trying to interpret the scan, freeing up the medic to focus completely on treating the patient. This leads to faster, more confident decisions about who needs surgery right now, and that directly combats preventable deaths from trauma. Now, there is one crucial thing to remember with these incredible results. The AI was trained on data from swine models. And while they are biologically similar, the next major hurdle is to get these same results with clinical data from human patients. That is the absolute key to bringing this technology from the lab to the front lines. Still, this research offers just a tantalizing glimpse into the future of emergency medicine, a future where a medic's most trusted partner in saving a life might not be another human, but an incredibly perceptive algorithm. And you know what? That is a future worth thinking about.